guys, it's Queenie Grace here today, and today's video is going to be about my nursing essentials that I personally needed for nursing school. So I just want to share it with all my fellow nursing students and people who's getting into nursing school. So I hope these help, and because they really did help me. So let's get into the video. Okay, so the first things you know when you get into nursing school, they tell you what to get, and for clinicals basically. So you need your stethoscope, your PENLIGHT, and a scissor. Really that's all I needed for clinicals. And oh, my memo books. Like, these were life. When I needed to write a patient's information, there's still actually patient's information in these books, but if I want to write patient's information, a checklist, a to-do list, so I didn't forget anything. When we used to do morning reports, I would just write everything down because I liked it this way, so I didn't forget anything. It was super helpful, super easy. I love keeping these. So the next thing I talked about is the PENLIGHT, and for some reason I do not see my PENLIGHT. I think my son was playing with it because I seen it in his hand the other day, and now I'm trying to pull it up for this video and I can't find it, but I'm gonna put a picture of it right here. This specific PENLIGHT, I really love it. I hate the battery ones, or the ones that you have to change the battery. They suck. The batteries always die. They're always turning on in your pocket. I just hate those. So I buy these disposable PENLIGHTs. Like, once they're gone, they're gone, but they're really good. You just press the little handle. Darn, I wish I really had it. And I really love the ones with the pupil sizes, so it really makes assessment easier, so you don't have to sit there and kind of guess like, okay, their pupil is you know, it would tell you right there exactly. So you would just compare it with the circles on the PENLIGHT and it just write what you assess basically. And then the next important thing, I don't have it with me right now, but it's a scissor. I'll insert a picture right here. You would want a medical scissor. They really do come in handy. The hospital doesn't have that ready for you. They just don't. So when you need to cut like bandages, or you know, you're doing wound care and you need to cut those bandages, or if you're just wrapping a bandage, really that's all I use it for, is to cut gauze and bandages, but they really do come in handy. The next thing I would say is a must for especially clinicals is my stethoscope. This one is actually a Littman Classic 2. I brought it for like probably $80. I'll put the link down below, but I don't think any more than $80. My mom was like, listen, I'm getting you this stethoscope, you better guard it with your life. This will be your forever stethoscope for the rest of your nursing career. So I've kept that, but honestly guys, you really don't need to go out and buy an expensive stethoscope. You just really need something simple and plain, just so you can do your assessments. I mean, you don't need anything fancy. And now we're gonna go into basically lecture study things and how basically I got through nursing school. A planner. I absolutely love this planner. This is the 365 planner. I actually got it at Michael's and it was on sale. I believe it was probably like half off. I don't remember the price. I will link it down below if I do find it. But this is, anybody who knows me ever since high school, I always had a planner. Like, I love these things. They help me stay organized because I do forget, and I do have to check my calendar. Like, oh my god, homework is something I would always forget, and due dates, like those were my biggest tasks. So this solved my problem. This one has been by far my favorite one, because like, guys, is this not the cutest thing? And what I love is that you can insert things. Like, you can take this out. I don't want to take it too much out, but you see how I just popped that out? You could pop pages out, you could pop pages back in. And this one was really nice. It had birthdays, goals. Obviously I didn't, this is 2016, so it's all empty. If you go to 2017, like you can see my writing, right? Like, this was all the crap I wrote. Like, I played no games with clinical papers and birthdays and accomplishments I would write. I mean, I played no games with these planners, so I really love this. It really helps me stay on top of my game and on top of things. Thing is a really good binder. I would suggest like a 1-inch or 2-inch binder. I love this because you really don't want to throw away all your nursing notes that you accumulate during your time at nursing school. So I really do love this. I keep all whatever is important to me. They're divided. Any handout a professor would have gave to kind of help us remember stuff. Like here's something about like isotonic solutions. I really like it. I keep all my conversions, basically a reference binder, so I really don't forget things, because I really do sometimes when it comes down to it. If you have like a test basically testing you on everything you should have learned so far, you forget things. This is a great thing that I like to keep references and important notes. Another thing that I really love that really helped me study throughout nursing school is index cards. These things are the bomb. I was going to try to organize and show you guys my stash of index cards, but this is not even half of it. Like, I can't even organize it for you right now, guys, but it really does help. So if you find yourself having a hard time remembering things, I would really strongly suggest using flashcards and really studying them. They really do help you retain the information. If you have somebody else to help you, like, okay, what is this? And then you'll be like, oh, I know that one. That's da da da, and they'll be like, what else? And you'll be like, oh, what is it? And once they tell you, you would never forget it, okay? You hate yourself for forgetting in the first place. So I would strongly suggest index cards. Another thing, a nursing student's best friend are these pencil cases. This one I got actually from the dollar store. I switch them out quite frequently, but in here, oh my god, you need everything that's in here. Colored pens are like a nursing student's best friend. For some reason, I really don't see all my color pens. It's like I only like purple and pink. Of course, highlighters. I have these two highlighters. You want to make your notes colorful. You want to make them pop, because doing notes and reading them back can be boring. So you want to retain things, and when you see things that's highlighted, you're like, okay, that's important. Or, you know, when you write in color, it's more fun, to be honest, guys. So the next thing I like to share, I think it helps with both clinicals and lecture classes, is the NCLEX RN Drug Guide, and this is by Kaplan. I really do love this book. It has every medication you need to know for the exam. Exactly what it says. It's small. I keep it in my purse sometimes. Reading these really do help. They help you memorize the side effects and the classes and the different names of the medications within those classes. So this is a perfect way of memorizing meds. So another quick tip is memorizing the suffixes. So if you remember the suffix of a medication, or you know, the class, like zone is always basically steroids, pril is always basically ACE inhibitors, and so on. So if you can remember the suffix, they kind of do help sometimes, because you really can't memorize every single medication. I almost forgot another thing that I've seen nursing students usually use are these clipboards. I'll put a link below or in a picture of it right here. These clipboards, I believe they're called WHITECOAT clipboard. I never used it, never cared for it. I felt like the only use it really had was to carry all your papers, like your care plans and whatever, in your pocket. It made it easier, but I mean, of course it has some references, ranges of vital signs, normal lab values and stuff. Honestly, guys, I just write it in the back of my badge. And another thing, this is not really mandatory, you know, an essential thing, but cute badges do not hurt. I love me some badges, and my good friend, she's a fellow nursing student, and she makes these. If you would like to know her Instagram or whatever, just let me know, and I'll comment back letting you know her Instagram. So yeah, guys, this concludes the video. I really hope this helped you guys, give you a little insight on some things. I'm just sharing with you guys what helped me, and I hope it helps some of my fellow nursing students out there. I'll see you in my next video, guys. Bye.